Welcome. We're so glad you're here. We're seeing folks greet us in the chat, and we appreciate that. You have joined the Loneliness Epidemic, the impact of social connectedness on our health and well-being, with Erin Ficker and Chris Gabrielson. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. The PTTC believes that words matter and uses affirming language in all our activities. I want to share a few housekeeping items with you. If you have technical issues, please individually message me, Rebecca Buller, in the chat section at the bottom of your screen, and I will be happy to help you. If captions or live transcript would be helpful, please use your Zoom toolbar near the bottom of your screen and choose live transcript. AI note taker options. Please do not activate an AI note taker application. We do not allow this for several reasons, and we will ask you to disengage. And if you do not, we will remove you from the Zoom room. If you have questions for the speaker, put those in the Q&A section, also at the bottom of your screen. This helps us not lose your question in the chat as it scrolls by. You will be directed to a short survey link at the completion of this webinar, and we would appreciate it if you could fill it out. It only takes about 3 minutes. It helps us improve our offerings and report to our funders. And finally, certificates of attendance will be sent out via email to all who attended this webinar in full, and it can take up to 2 weeks to receive those certificates. And now I'm going to turn things over to our presenter. Chris Gabrielson is with us this morning, and she's the co-director of the Great Lakes Prevention Technology Transfer Center. She's worked in substance misuse prevention field for over 30 years and has a master's of public health degree and is a certified prevention specialist.
All right, thank you so much, Rebecca, for getting us started. Well, as you can see, Erin was supposed to be here with me. Unfortunately, a tornado went through their town last night. She's fine and her family's fine, but they are without power. So unfortunately, you're just left with me this morning, but hopefully that will be sufficient. It is great to be here with you all. I know several of you have been putting information in the chat. I would love to hear from all of you, both your location as well as your role of what do you do if you work in the substance misuse prevention field. What do you do? Do you work with a community coalition or in the schools or another organization? Do you provide training in TA? Or if you aren't in the prevention field, I'd love to know which field you are in. So thank you. I see lots of folks putting in the chat right now. Good to know. All right, and love hearing where everybody's from as well. All right, thank you for taking the time to do that and continue to do that as as we continue to move on. All right, well, today we are here to talk about the loneliness epidemic and social connectedness. With our brains the way that they are, we are wired to be socially connected beings. And this is a quote from Matthew Lieberman, who is a social neuroscientist at the University of California, Los Angeles. And he says, to the extent that we can characterize evolution as designing our modern brain is what, excuse me, this is what our brains were wired for, reaching out to and interacting with others. We are social beings. Our brains are wired for that. And even things like with social pain that we experience, the social pain that we experience goes through the same neural pathways as the physical pain that we experience. So when we talk about we're wired to be connected, truly our neural pathways are wired to be connected in terms of avoiding that pain, any social pain, that just as much as physical pain. And yet we find ourselves isolating at times, and some more than others at different times in our lives. But we find as our society gets more pulled into screens, as shown on this on these pictures, we definitely find ourselves isolating at times, and especially as a society compared to years before. And of course, we saw with the pandemic the impacts of having to be isolated, for very good reasons, but yet we were isolated and it had great impacts. Where we're at right now with when we looked at the pandemic, we definitely there was the increase in isolation and loneliness definitely decrease or increased, but and it did come down a bit, but still, look at this. 30% of US adults say they have experienced feelings of loneliness at least once a week in the past year. So this is even though we are no longer in the pandemic, we are still experiencing, that's almost 1 in 3 folks who are saying that at least once a week they are experiencing loneliness. And when we talk about loneliness, this is really, it's a subjective feeling. It's not we can't put, like, if we talk about social connections, we can actually put numbers on it. But when we talk about loneliness, it's a subjective internal state of being. So in the US Surgeon General's report, which we're going to talk about a little bit more in a bit, they talk about that loneliness is a distressing experience that results from perceived isolation or unmet needs between what a person's preference for social interactions are and their actual experience. So I'm going to say that one more time. And so it's the difference in it's what we're perceiving our needs are, and it could be so real or not. So this is the perception. So the perception of isolation and unmet needs between what a person's preference for social interactions are and their actual experience. All right, so thinking about, like, I'm an introvert. You may not be able to tell that because I may not sound like it during a training, but I am a true introvert that I need to be alone to gather my energy and to really be able to perform, while extroverts often need people around them, or they do need people around them to gather that energy. So for me, isolating is an important part of my own mental health. That does not mean that I'm lonely at that time. So it's that perception that I'm not perceiving that I'm lonely because I'm being by myself to gather that energy. So that's the distinction there. It's what I feel like I need and whether or not I'm getting it. It's that perception. So loneliness is a subjective internal state. So when we do these surveys to find out how people are feeling, that's their own people's own perceptions of how they're feeling. All right, let's look at a few more data points just to help set the stage for the rest of our discussion today. 10% of US adults say they're lonely every day. And this was from January 2024 by the American Psychiatric Association. 30% of US adults ages 18 to 34, so looking at those younger adults, say they were lonely every day or several times a week. So again, almost a third of 18 to 34-year-olds. And this was that same survey by the American Psychiatric Association in January 2024. Thought this was an interesting graph of the percent of adults lonely yesterday. And this is a percentage of folks, and you'll see here that it goes from 14% to 20%. And look at this distinction between the different regions of the percent of loneliness. I'm curious I'm sure we have somebody from every one of the regions shown on here. Does this ring true to you in terms of a difference in levels of loneliness of looking at that Northeast region, which is interesting to me, but in Great Lakes region, where we're housed out of, that's darker green. What do you think? I'd love to see in the chat what you're thinking if this rings true to you. Tom says, yes, it's ringing true to him. Anybody else? What do you think? Yeah, longer winters. Interesting, Holly. Yeah. And that's a good question. With the time of year it was asked, that's a good question. Yep. Oh, and the lake effect, Connors. That's a good point. Yep. Absolutely. Okay, good points, everybody. So yeah, interesting. And I will have to look. Well, actually, it does say right here, February. It was done in February 2023 was the time of year. So thinking about seasonal depression and the effects of the winter, that would definitely hold true, wouldn't it? Love the way you're all thinking. All right, yes, February blues, as Elizabeth says. Love it. All right, then let's look at youth. This is a global study by Gallup that found that 1 in 4 youth ages 15 to 18 feel fairly or very lonely. And it was interesting when I went to look for data on youth, there were very few, and this was a global study, but for in terms of looking at US data, I did not find any good data points for national data within the US or even regional within the Great Lakes region. So I'm curious if you could say, put in the chat if you have any local data that you have seen that looks at 15 to 18-year-olds or younger. I see, Michelle says, what about children? And that's where I looked and looked and looked for data on kids and did not find it. So I'm curious. I know there's school surveys that people, for example, I know some PFS grantees do school surveys where they include loneliness questions within their school surveys. I'm curious what if you have that. And Holly, you said that, and Amy both said YRBS data. That's a great question. I didn't find it, but maybe I missed that. So, and somebody's Minnesota State survey asked a question. Great. So if you're in Minnesota, you can access that data. Um, and the CTC surveys, good. So I love this. I knew there would be a group think on this of other sources of data because I did not have success looking at it on my own. So keep putting in the chat if you know other sources of data for youth or children in terms of loneliness data. Great. Thank you all. All right, then let's look at parents a little bit. There's some interesting data around parents and loneliness. And this was a huge number. 66% of parents felt the demands of parenthood left them feeling isolated and lonely. And this was a survey done out of Ohio State University College of Nursing in Columbus. I'm curious, for those of you who either currently are, well, your parents, caregivers, it may be that you care for other kids, maybe you have nieces and nephews that you've ended up caring for, or you might be grandparents who are in a parenting role. Curious what you think about this in terms of, does this ring true to you in terms of feeling isolated and lonely as parents? Yeah, I'm seeing some thumbs up in terms of reactions. Feel free to use the reactions at the bottom of your screen. But yeah, I know for me, thinking back, my boys are now 19 and 21, so I'm seeing lots of thumbs up. So it definitely rings true. Okay, good. Um, Not good in that I don't want that to be, but that the data is reflecting what people experience. I remember, especially when kids were younger, definitely that feeling of isolation and loneliness of, just trying to get through the days with these young ones, especially when they're sick and different things. Um, and as empty nesters, yes, that's where I'm at. I with the 19 and 21-year-old, have my younger one home for the summer for a couple months, but otherwise, that definitely can be a big change when we become empty nesters. So curious thing with another point of data within that same survey, though, is that 82% of moms and 74% of dads said that they would value a way to connect with other parents outside of work. So when we think about opportunities to do some prevention work, this is a great place, great opportunity to be able to work on some social connectedness issues and connecting folks, connecting parents to be able to help address those feelings of loneliness and lack of social connections. So the question then is, well, why is this a concern? Why do we need to worry about this? Obviously, we talked about we're wired as social beings, but why does this really matter? Well, it matters greatly. And in this report in 2023, the U.S. Surgeon General's report, he talks, the folks who created it, um, talked about the impact of loneliness and isolation. And I'm going to give you a few of those statistics. But before I do that, I want to make sure that everybody knows that this report, you can download it from our product page, where you can also download the PowerPoint slides that I'm going through right now. So if you want to download this report, just go to our product page, and on the right-hand side, there's some brown boxes, and one of them is to click on this report. Highly recommend that you do download it and read through it. It's filled with great information. And as we're going through here, if you're like, oh gosh, I wish we would have talked a little bit more about this, go to this report, because you will probably find more information on that very topic within this report. So when we are thinking about the impact of social connectedness and loneliness, here are a few of the impacts. Our ability to rely on one another has been crucial to our survival. So, thinking of past years, long, long ago, especially, when our survival truly was linked to one another. Um, but because of that, our brains have adapted to expect proximity to others, as it says on this slide. So, again, thinking about those neural pathways and how things are created within our mind, within our brains, that is something that our we crave as social beings. And so, as I've already said in so many words, even now, our biological need to connect remains, as you'll see in other animals as well. Social connection is a fundamental human need. And again, looking at this, it's across the lifetime. It's not just at different stages of our life. It's from birth up through, as we become older adults, up through death. And social connection, so let's define this a little bit more. I keep using that term. So when I'm using that term in this context today, it's the feeling that you belong to a group and generally feel close to other people. So just in simple words, it's that I'm a part of a group, I feel connected, I feel valued, I am part of a group, I'm connected with these folks, people care about me, etc. That's that social connection piece. So when we don't have those social connections, it has an actual physical impact on us. And as it says here, that this a lack of social connection is it's the same, it has the same impact of premature deaths as smoking up to 15 cigarettes a day. So this is not just whether or not we care, how we're feeling, which is important, but it actually has a physical impact on us as well. And also, a lack of social connection increases the risk for anxiety, depression, dementia, heart disease, risk of stroke, and other things. I just listed a few of those things here. So again, this impact of our lack of social connection has a physical impact on us. I say dogs are the best social connections. Yes, our dog's wonderful. Love this. Love this picture. A few other impacts that they talk about in that U.S. Surgeon General report includes one for older adults. It's increase in expenditures on hospitals and nursing facilities. So the again, the impact on physical ailments ends up costing money, as well as, of course, the impact on that person's life of needing to be in the hospital or in a nursing facility. We also see an impact on academics. So for those in school, that we see lower academic achievement for those who are lacking social connections. For people who are in the workforce, we see worse performance at work and stress-related absenteeism. So again, looking at the impacts, regardless of where we are in our life, it has a negative impact on what we're doing. All right, so that sets the stage in terms of what we're talking about with social connection, why it's important to us, and the impact that it has on us, as well as the level of loneliness that is existing within the U.S. right now. So, with that in mind, let's go ahead and I'm going to take a quick moment here to look at the Q&A before we jump into what we're going to do about this. So Katrina was asking about the definition of loneliness. Is it under development by researchers, or is it pretty much settled in the literature? I would say that it is not settled, that if you look at the different sources, they do have it defined in different ways. You're saying, I'm wondering because I think the definition needs a little work to account for the full range of situations and psychological states that are representative of people who can relatively easily be categorized as lonely. Good point. All right, and one other, how is emptiness distinguished phenomenologically from loneliness by researchers in the field? I could not tell you the answer to that. I would need to look into that. So I'll take that back, and we will try to get you an answer via email once following the webinar. Great questions. Thanks, Katrina. All right, so let's go ahead and jump into, oh, and I see Jamie just added, oops, sorry, let me get this. Does this impact introverts differently? So when we're thinking about the impact on introverts, it's more, and let me come back to that, because we're going to talk about how loneliness is on a it's on a continuum. It's not either you have it or you don't. So when you think about introverts, no, I'm rethinking this answer. I would say loneliness impacts introverts just the same as extroverts. However, again, going to that, it's the perception. When an introvert, such as myself, is alone, my perception of being loneliness is not there, probably much less often than an extrovert. So if I was an extrovert and needing to be around people, and I've lived closely with people who are extroverts who definitely need that, and so I believe they experience the loneliness can happen to them more readily when they aren't around people, while introverts are like, yeah, I'm perfectly fine being alone right now. And being alone does not feel lonely. So again, remember, it's back to that perception. It's that internal state of being. So hopefully that helps clear that up. All right. Oh, and I like Vivian says introverts see loneliness as the reset button. Yeah, but we don't view it as loneliness though. It's being alone versus loneliness. In my mind, that's the distinction. All right. Let's go ahead and move into what are we going to do about this in terms of how can we look at creating those social connections to help people increase their social connections and in turn decrease loneliness. So with research, again, looking at research, going back to that, they've identified 3 vital components of social connection that we're going to go through in the next several slides. And again, this is from the U.S. Surgeon General's report, and they base it off of research that was done by others. So again, go back to that report if you're wanting more details on any of this. So let's look at those 3 vital components. First of all, a structure. Structure is the first vital component of social connection. And when we are looking at structure, what we're talking about here is the number and variety of relationships and the frequency of interactions. So this is more what we typically think of when we're talking about social connectedness. It's how many people are we connected to closely, and what are the variety of those relationships, and how often do we connect with those folks? So some things that are come into play often with this include household size, of the number of people who are actually in your household. That doesn't necessarily mean they're actual family members, but how many people do you live with? Do you have roommates, housemates? Maybe you might have multi-generations within your household, etc. This also looks at your friend circle size, in terms of how many friends do you have that you are connected to in terms of those quality relationships, quality friendships. And this also is impacted by your marital or partnership status in terms of your, because that is inherent in how frequent you have those interactions, and of course the types of relationships that you have. So structure, number and variety of relationships and frequency of interactions. So that's the first component in terms of social connectedness. The second component is function. Function is the degree to which relationships serve your various needs. The degree to which relationships serve your various needs. So these are things like, how much emotional support do they provide to you? Things like mentorship, of how do you feel like you have mentors who can help you in your various roles within, if you're a parent, do you have some parent members in work? Do you have mentorship? If we're talking about youth, do they have good adult role models or mentors within youth? This is also looking at, when things come up in your life, that there are the crises that come up in your life, the different life events. Do you have people you can turn to for support in a crisis? Okay, so function is the degree to which relationships serve the various needs that you end up having in the course of your life. So that's the second component. And one more component if we want to look at is quality. So these are the positive and negative aspects of relationships and interactions. The positive and negative aspects of relationships and interactions. So this is looking at, so with quality, we're looking at our satisfaction in these connections, our relationship satisfaction, the relationship strain. Yeah, we can have some really close relationships, some strong social connections, but if it's a negative impact on you, a drain to be connected with somebody, then that's going to impact social connection. All right. And social inclusion or exclusion is part of this quality component in our social connectedness. So structure, function, and quality are the three vital components of social connection. So when we're looking at creating those social connections and what we can be doing in our prevention work to create social connections, we're going to want to pay attention to all three of those components. Few things to think about with these three vital components is, first of all, social connection is a continuum. So when we're talking about, it's not just, are you lonely or not lonely? It's there's like extreme levels of loneliness to extreme levels of not lonely, right? So it's highly socially connected. And it's a continuum. So it could be that, I'm feeling a little bit lonely right now, or it's like, yeah, I'm feeling completely isolated, so it's definitely a continuum that we're looking at as we're examining loneliness and social connection. And as it says here, social connection is dynamic. This changes. It can change within the course of a day, right? I'm guessing. If anybody else, there are times in a day where there could be a moment where I'm feeling lonely, and then there's another part of the day, and like, yeah, I'm good. I'm not feeling lonely at all. But this can also change in terms of um, different life events. So it can be your own life events of changes in your own life. It can be within your community, life event or events impacting your community. Of course, things like the pandemic had a global impact on our feelings of isolation and connection. Um, but when we're looking at, some of these are really transient feelings of loneliness, and those, where they kind of come and go in a day, it's like, oh gosh, that might be a little lonely. We aren't as worried about these transient feelings of loneliness. They usually are not a problem in terms of impacting our physical well-being, things like that. But the chronic loneliness is where we really are needing to address this, and becomes a problem and has an impact on both our mental health as well as our physical health. So again, social connection's dynamic. It goes up and down, course of day, course of our life events. Um, but the other thing is, temporary solitude where we kind of pull in is it actually can help us manage our social demands. So there are times again that piece of being alone can be helpful. So just want to make sure I'm not saying that we always have to have people around us and we have to make sure we're constantly in connection with folks. It's not that. It's again that feeling of um, loneliness that gets to the severe end of the continuum. The chronic loneliness is where we really need to pay attention. Yep, and Martha, you said it well. You think feeling lonely time to time is different than feeling lonely most of the time. Yep, absolutely. That's a difference. One more point about the these three vital components as we're thinking of the three vital components of social connection, of structure, function, and quality, is the absence of loneliness does not necessarily equate to high levels of social connection. So when I first read this, I was like, wait, what? What are we talking about here? So someone might not feel lonely, but at the same time, they might not be reaping the rewards and benefits of social connections, such as feeling supported, having high quality, close relationships. So, while we're talking about loneliness and we want to make sure we're addressing chronic loneliness, just because a person, again, that perception, just because a person isn't perceiving that they're lonely, that doesn't necessarily mean that they're also socially connected, have a high level of social connectedness. So we still need to focus on that piece. All right, and with that, I'm going to pause for questions one more time, make sure there aren't any that we need to address right now. What is the difference between solitude versus loneliness, and who should determine what is good or bad for someone? And again, Michelle, that's why when the surveys are done, that they're looking at it's the perception, a person's own perception of whether or not they're lonely. Because you're absolutely right. My perception of when I am lonely, going back to again as an introvert, is very different than another person who's an extrovert and is alone. They might feel lonely. They might perceive themselves as lonely in a situation where I would perceive myself as not lonely. So, absolutely. It is loneliness a risk factor with ACEs? I do not believe it is. I don't have that on the top of my head right now. I'm guessing somebody else on here is really knowledgeable about and has that on the right in their brain. Feel free to put in the chat if you do, but I don't believe it is. All right. And with that, Rebecca, was there anything else I was missing that there were questions that I should address at the moment?
No, there's some great comments in the chat, but no questions at this time.
Okay, great. Thanks, Rebecca. All right. So let's turn our attention to our work as substance misuse prevention professionals. Obviously, this is something that is not our primary concern in terms of, when we're talking about preventing substance misuse. We aren't told to, okay, you go out and address loneliness, right? But the reason why we did this webinar is because the loneliness has an impact on the work we are doing, and especially on risk and protective factors for substance misuse. So we are going to get that and loop around to that of why we should be thinking about this within the context of our substance misuse prevention work. Some actions that we can take as substance misuse prevention professionals. I've have them listed here as a summary, but I'm going to go through these one by one. So I'm not going to read through each of these, but there are 5 things, 5 specific actions that we as substance misuse prevention professionals can be taking in the course of the work that we're already doing. So not that we have to go out and do this whole new thing and we have to add on yet a whole nother set of responsibilities, right? Because how many hats do we already wear and how many things do we already do? But what can we be doing within the context of the work that we're already doing to also impact social connectedness? So first of all, we can build a culture of connection. So here's on this slide a few thoughts around how we can do this and what we can be doing. But really, when we're thinking about the work that we're doing, so it could be that we have a community coalition. What can we be doing within our community coalition and within those coalitions to create more social connection amongst our community coalition members? Or as our work, if we're working with youth, what can we do to cultivate values of kindness, respect, and service and commitment to one another, amongst those youth? Or it could be with others, professionals that you work with across your community. And as it says in that second bullet right there, model connection values in positions of leadership and influence. So as you are doing your work, you're being a leader within your community. What can you model to help create those social connections? And again, remember going back to those three vital components of social connection, the quality, structure, and function. What can you be doing to incorporate those vital components into the work you're doing, into the meetings that you're holding within your community, within your coalition, etc. So building that culture of connection is one action that you can be doing as a substance misuse prevention professional. Another one, strengthen partnerships. That again, this is something we are doing a lot of in our substance misuse prevention work is creating those networks, those partnerships. The folks that we're working with that you might already be working specifically on this aspect. So, for example, if you're working, if part of your work is with older adults, what partners could you have or might already have that are working on creating those social connections? It might be within schools, if you're working with schools, which partners can you work with that might already be working to address these social connections, and how can the work that you're doing really leverage what they're doing to be able to augment what they're doing. Another action you can be taking as a prevention professional is to educate community members on social connection and the importance of this. So as you are talking about other things, you can pull in this component as something that we want to be sure to be considering in our work and in our community connections, as we are. Um, I lost my train of thought. Sorry about that. But so as we're working with our community members, um, we have these opportunities to talk about social connection and to look at for other opportunities to create those social connections. Another action we can be taking is to look at what data you already have, for what information you can glean from that of what work needs to be done around social connections. So I know when we talked about the youth data that I was having trouble finding some specific data points. Many of you put in the chat the different surveys that you have access to where you can access this data. So tapping into that and sharing this data with those partners, educating community members on with the information from that data is key. All right, and the last action that I had listed was to look at addressing risk and protective factors associated with social connection. Heart and soul of the work that we're doing in substance misuse prevention is to look at what risk factors are prevalent within our communities and how can we reduce those risk factors, reduce the prevalence of those risk factors, and where are the gaps within our protective factors and how can we be increasing protective factors within our communities, or the specific folks that we are working with, our focus audience. So we're going to pause and we're going to go take a deeper look at risk and protective factors. All right, so let's first look at youth. And these are some examples. This is not an exhaustive look at risk and protective factors, but let's take a look at a few things, few risk factors that we often are working on addressing within our communities. One is the low neighborhood connection or low neighborhood attachment is a risk factor. We know that when having low neighborhood attachment in a community, that the likelihood of substance misuse increases. So when thinking about social connectedness, and if we're working on addressing a neighborhood attachment and connection, this is a prime opportunity to increase social connectedness. So what I'd love to see in the chat, some examples of ways if we were addressing the risk factor of low neighborhood attachment within our community in order to reduce the likelihood of substance misuse, what are some strategies that could be put in place that would both be working on that and also increasing social connection? Love to put in the chat, what are some ideas of either things that you just thought of or some things that you have done within your community to increase neighborhood attachment? Increase neighborhood events. Yes, ways to connect. Absolutely. And I know I live in a cul-de-sac, and as when my kids were young, we had other neighbors. There were 12 kids within our little cul-de-sac. So the neighborhood attachment that was happening was intense because we had these kids they would just all come out and be together in the cul-de-sac, and the parents would come out, so we'd be able to connect. So, yeah, the ideas that you have here in the chat, things like National Night Out is absolutely a way to start connecting with one's neighbors. We had National Night Out events here at our cul-de-sac for, I think we had 20 years before we hit the pandemic, and then we lost steam. We need to pick up on it. Um, so block parties, but with the key with these things, so these National Night Out and block parties, neighborhood events, these kind of things, is you're wanting to make sure they're structured in a way that these social connections are happening. So it's not that people are coming out and then just sitting there with their own families and there's not a way to connect. So it's to be very intentional to create those social connections. Let's see, Karen says our community coalition brings various people from many area organizations to the table to address child abuse prevention. They're doing things to increase social connections of those who do the work. You just did a pottery class together. How lovely. I love that. Again, so creating those opportunities where you can create those meaningful relationships and really feel like there is that connection, that social support. Love it. All right. Love these ideas. I'm scrolling through the chat here. All right. So low neighborhood attachment or community connections, as we're addressing that within our substance misuse prevention efforts, we can keep that intention of how can we create those social connections within those efforts. We're going to multiply the impact of our work. So let's turn to poor academic performance. So those youth who are struggling academically, often, not always, but often they are also feeling disconnected from school, from those social connections within, it could be with their peers, within the teachers, within the support systems within the schools. Not always, but it can often be the case. So when we're thinking about addressing poor academic performance, as a risk factor for substance misuse prevention, what are some social connectedness strategies that we could put in place to both address academic performance as well as increasing social connectedness? If you could go ahead and put that in the chat. What are some ideas? After school clubs can also be helpful to give a sense of belonging. Absolutely. And Patricia, another risk factor is low commitment to school. And that would be, I think your point there could do a very good job at addressing that as well. Study groups in the school at lunch hour, peer study groups were some ideas. Absolutely. To create that connectedness amongst a group of folks. All right. Great, some great ideas. So again, it's all about being intentional as we're looking at what strategies we're implementing. How can we create those social connections at the same time? All right, more ideas. I love the ideas that are in the chat. Everybody be sure to keep reading through those as well. So I put a couple of other risk factors here that could be some natural ones where we really working at increasing social connectedness while we're doing our other work. So including antisocial behavior and extreme family conflict. All right, so that's the risk factor piece that in our prevention work, we're wanting to both increase our protective factors as well as decreasing risk factors. So this is that decreasing risk factors piece. So let's turn our attention to increasing protective factors. This is a really natural place where the work that we are already doing as substance misuse prevention professionals already, even without even some more intentionality on our part, we are increasing social connectedness. And for those of you, I'm curious how many people, if you'll please put in the chat, if you attended the protective factors webinar that I did. I've done it. I did it once. When was the last time? More recently, and then I did it also a year and a half ago or so. Put in the chat or put a thumbs up if you attended the training on the social development strategy. I'm curious. I'm seeing one thumbs. I've seen, yep, seeing some thumbs up and some in the chat. All right, great. I'm seeing some folks did. Okay, so for those of you who attended, I'm going to have you pull back to what you learned there. If you did not attend it, it is a recorded webinar that you're welcome to watch. And I highly recommend that if you haven't watched it yet, that to go ahead and watch the recording. There is also a healthy knowledge course done by the Northwest PTTC, that's Region 10 PTTC, that they created on risk and protective factors. That's another way you can learn about the social development strategy. So in my mind, the social development strategy is an ideal way to operationalize protective factors, to put them into action. And the idea behind the social development strategy, or the key part of that, is to create bonding, commitment, attachment with those who are conveying healthy beliefs and clear standards. So when we're thinking about, I'm going to go ahead and go to the next slide. As I just said, what we're doing as we're implementing the social development strategy is we are providing opportunities, skills, and recognition. Hopefully this is sounding familiar to folks who did attend. We're going to provide opportunities, skills, and recognition to youth in particular as the focus of social development strategy in order to create bonding with people who are conveying healthy beliefs and clear standards. So when we're talking about social connections, obviously we're talking about bonding, that commitment, that attachment. So as you are doing your work, as you're working on implementing and putting into action the social development strategy, you are addressing increasing social connections, and you are addressing loneliness. So again, this is not something added on to what you're doing. It's what you're doing already, which I feel is very reassuring to know that the work that we're doing as substance misuse prevention folks is already addressing some of these critical areas within our larger communities that need to be addressed. So and Rebecca put in the chat a link to the recording and the slides of the last time that it was offered. It was in December, that's right. Gosh, it feels so long ago, but that really was not that long ago, was it? All right. So let's see. Well, let's turn our attention to older adults. Just again to give you some examples. Not that we want to ignore all of the ages between youth and older adults, but I want to give you a few more examples. So some risk factors that we know increase the likelihood of substance misuse among older adults include social isolation, social changes, and economic stressors. So social isolation, again, talking about life events and how this changes over time. Life events impact our loneliness level. We talk about the structure. One of the vital components of social connectedness is structure. Thinking about the households and the changes that older adults often experience as they're aging. So social isolation, as we're working to address that risk factor of social isolation, obviously we are creating social connection. So we're inherently doing this work already when we're addressing that risk factor. Social changes, again, looking at the impact of those transitions that that older adults are experiencing. If we can create those social connections to help address those changes, we're both addressing that risk factor and addressing loneliness at the same time. And again, economic stressors, same kind of thing. Okay. All right. And when we're thinking about protective factors with older adults, here's some examples of things that we can do to help. By increasing those protective factors, we're reducing the likelihood of substance misuse, but we're also creating those social connections. So, creating those supportive networks and social bonds, creating that sense of identity and purpose, ensuring or nurturing supportive family relationships. And again, the family, it might be the blood relatives, but it also could be those other families that are created that are not necessarily blood relatives. All right, increasing our protective factors, decreasing our risk factors. We can do the work of our substance misuse prevention work while also increasing social connection. Thinking about this, I have a couple. These are my friends, Phoebe and Phil, and I got permission to share this story with you. So just to let you know and to use these pictures. Um, my dear friend Phoebe passed away about maybe a little over a month ago. She had had some health issues, but it still in the end was somewhat of a sudden passing. And Phil, my other dear friend, they had a loving, incredibly loving relationship for over 30 years that they were married. And they knew each other before that even for 20 more years. But it's been interesting to think about and, you know, not that I'm analyzing all of my relationships, but watching Phil during this life transition. I was over, I've been connecting with him via text and email, but at first he wanted to be alone. He wasn't ready for the company, but then at a certain point, there were about 15 of us or so who went over to his house to help with his yard because they're going to hold the Phoebe's memorial service in their yard. So when I arrived, there were just a couple of people there. So when I arrived, and Phil came out, and he really looked bad. I mean, which obviously for good reason, right? But he just looked drained, and like he was just kind of barely moving along. Then we left maybe I was saying my goodbyes maybe 2 hours later after the 15 of us were working hard, and then we had some dinner together, and the life in his face, it was just like the energy, the it's his whole being. It was like he had just absorbed all of this energy of all of us, and he was back to his old self in terms of seeing the of livelihood. That's not the right word, but liveliness of him and how he was feeling, and he was just so appreciative that we were all there, and he literally felt better at having us be there and seeing that social connection and working together. So to see that in a span of 2 hours of the same person and the impact of, again, thinking about the vital components of social connectedness, of structure, function, and quality that we had created just even within those 2 hours had a significant impact. So think about this. I'd love for you to also keep these things in mind as you're interacting, folks, in the coming weeks and months to see evidence of this impact of what we can do of our day-to-day interactions, what we're doing within our own lives, what we're doing within our work to see the impact of creating this social connectedness. So if you might be willing, I'd love for you to keep that in mind as we're going along. So with that, I am curious. I have another chat question. Um, this What specific actions can you take to increase social connectedness among your coalition members and your coworkers, or even within your own personal life? The what as we've been talking about these different things, have there been some things that you're like, oh, I could do that? within meetings or it could be also within your own personal social networks. So be open, inviting. Yes, celebrate birthdays, laugh more. Laugh more, absolutely. Monthly staff events. Yes, paying close attention to secondary trauma measures. Yes. Host meetings, plan for time together. And that's, Gianna, I love that it's also thinking about, is there a way to have some of that social time for perhaps before or after meeting where you're having the chat times, even if it's via Zoom? Or is there some time to build in where you have those kind of water cooler kind of conversations? Love it. Team building activities, genuine check-ins. Yes. And Rose says, my colleagues and I have a weekly meeting called Water Cooler to connect personally and professionally. I love it. Absolutely great. Oh, I love these. Such great ideas. You could accept, Brenda says, I could accept the invites from friends and loved ones to spend time in fellowship with them. Yeah, we have to actually have to accept those invitations, right? I know, you know, again, going back to an introvert, there are times I'm like, oh, I don't want to go do those things, but then I go and do them, and it absolutely was worth it, and it feeds me, and absolutely. So we do have to accept those invitations. Kelly says she always does a fun icebreaker before the meetings to bring folks together. Love it. Don't take yourself too seriously. Love it. Oh, these are fantastic ideas. Keep reading through these. All right, and we download the chat afterwards, so I'm going to take time to read through every single one of these after we're done. Wonderful ideas. All right, so we're going to switch gears a little bit. So we're thinking about our work within the substance misuse prevention field and what we can be doing with that. But we also need to stay healthy ourselves, our own mental health well-being, as well as our physical well-being as substance misuse prevention professionals. If we are not strong and healthy ourselves, we won't be able to do the work that we need to do. So we're going to turn our attention to our own selves of what we can be doing. First of all, a lot of these are probably, no surprise, right? But you want to invest time nurturing your own relationships, reaching out each day to a friend or family member. So again, for those of us who may tend to be just fine alone, we still need to nurture those relationships and reach out to friends and families each day. So when we're thinking about the vital components, the 3 vital components, this is really looking at that structure of, do we have those connections? Are we making sure to stay in touch with our friends and families? Another thing that you can be doing, so if you're thinking about your own self, is when you are in those conversations, you want to minimize the distractions that you have. So putting your phone away. I know I have a good friend that we have coffee together. We try every few weeks, so we don't always get it, but we very intentionally put our phones away. Or if we're pulling them out to look up something, we're like, okay, we're doing this and we're good, then we're going to put it away so that we aren't constantly distracted by our phones. So minimizing those distractions during our conversations. Another thing that we can be doing for ourselves is to engage with people of different backgrounds and experiences. So this can really help in expanding our understanding of and our relationships with others. And we do see when we do this, when we reach out to people with different backgrounds and experiences, that what we see as benefits is that we have benefits associated with diverse connections. So when we talk about social connections, to have those different types of connections and a diverse set of connections is really important. So being able to reach out beyond maybe your typical sphere of relationships and how to create those, expand those to some diverse ones. Another thing that we could be doing, and again, this isn't too surprising, but as I was going through, it's like, okay, which ones am I doing right now? Which ones am I a little bit slacking on? Another one is to participate in social and community groups. So there's some suggestions here. And one thing that I do is I volunteer for our community emergency response team. It's called our CERT. And that's something that we often help with community events. Created, we're really created to respond in case of large scale emergencies, but we do work with community events to help. And that's something where I'm like, I kind of push myself to go do those things because that's my community service piece where I connect with folks. First of all, with diverse folks, it's people that don't always think like me, which is a really good thing for me to do and to be able to understand other people. But it's also a time where I do connect and get a chance to talk with people and connect with people in a meaningful way. So thinking about what social and community groups do you have access to or could you have access to help, again, create some more social connections. All right, another thing we can do is we can reduce our social media use, our time spent in unhealthy relationships, which can be difficult to do, right? And our screen time. So, you know, as we're on your social media, making sure, if you find you get sucked in, perhaps set a timer. It's like, okay, I'm going to do this for 5 minutes, maybe 10 minutes. I know for me, I'll put it up on my browser and after 5 minutes or so, I close it out. I don't want to open. I don't want to be tempted to go in and just mindlessly be looking through it. Of course, decreasing the amount of time in unhealthy relationships is very important when we talk about the vital component of social connections of the quality. We want to have positive quality relationships. And of course, screen time pulls us away from that social connectedness. And of course, seeking help in times of struggle, so important. It can be reaching out to family members, to friends, to a counselor, to your healthcare provider, to the 988 crisis line. You know, any way that you can reach out to folks who can support you during your times of struggle. So important. So basically, in a nutshell, by focusing on increasing our social connectedness in both our personal lives through these different actions that I just talked about, as well as our work lives, we will have an impact on loneliness and will increase our health and well-being. So looking both at our personal lives as well as our professional lives. And I know there's some more questions, so I'm going to pause now to be sure to look at those. Laura says, so there isn't data to show at what age loneliness starts. I have not seen anything on that. I haven't seen studies done on that. And you say you assume it can be connected with attachment, but since perception is part of defining loneliness, it could be hard to evaluate infants and toddlers. Absolutely. I'm guessing they have ways to do that, especially in terms of, I know they have done lots of attachment studies with looking at young ones. So I'm sure there are proxy measures for that in terms of attachment issues, but I have not seen a study per se on that. Katrina says, have any researchers studied the connection between people being on a mission in life versus people who are living in a way that is purposeless? For example, the daily routine of working in a job that feels purposeless, but is just a means of acquiring money to survive. She says, it seems to me that it is a state of loneliness because there's no sense of being on a mission together, which is how humans evolved. When being on a mission in life is missing, I think it could easily lead to loneliness. So, Katrina, absolutely. If you think about going back to the vital components of social connectedness, quality is a key piece of that. And when the quality isn't there, and remember we talked about the impacts of it, it definitely impacts our work life. And I would say it goes the other way as well. So our work life can impact our social connectedness. So I would agree with your statements. And Katrina, you said, do any researchers address unresolved, unaddressed grief and loss as a risk factor for development of chronic loneliness? I did not read on that, but I would assume yes. But I don't know that for sure. Michelle says, what is the most effective ways of reaching out, e.g. texting, calls, etc.? That's a great question. What do folks think? Put in the chat. What do you think would be the most effective ways of reaching out? I would say that in terms of the research that I read, that it's more that the personal connections of reaching out even by phone, so you're talking, or Zoom if you need to. But in person, I believe in terms of studies, in terms of social connectedness, that in-person piece is really important. But I know there's a group of close friends that I have. There's 7 of us that we have a text chat group where we check in with each other and the different things going on within our lives. And that's the way we live in 5 different states, I believe it is. We absolutely connect through that text chat. And those text chats also sometimes lead to, okay, we all have to jump onto Zoom because we need to support this person. And then we're all on via Zoom. So I would say probably any way that you can do it, that you can consistently do it, would be important. But we also still need the in-person piece, not just the technology piece, is what I believe the research would support. And I'm seeing in the chat, FaceTime, absolutely. Also, FaceTime can be great. In-person or voice call. Asking questions, Miranda said, in terms of when we're connecting is very important. So phone calls, group chats. There's video calls. Yep. So lots of different ideas there. All right. So hopefully that's helpful. And Connor says, do you know of any studies on empathy and social connectedness? I'd love to know more of what you're thinking of. I haven't seen something specifically on that. I'm wondering if you're feeling like you need to have empathy in order to have social connectedness. I'm not quite sure what you're asking with that. So if you can go ahead and clarify that, that would be great. All right. And then Adam says, do we know if sexuality or gender play a factor? I did not see anybody saying that that was a factor, that it's important for those of all genders and as well as sexuality. I did not see anything specific to that in the literature. All right. So let's think about moving to action. What can we do? What seeds can you plant as we're thinking about all of the information we've discussed around loneliness and social connections? Some possible next steps. These are some suggestions I have for some things that you might consider doing to take this information. As what we know is if you don't take this information and do something with it right away, it's going to go right out of your head. So it's not going to stick. So what things can you do for next steps? Have a water cooler chat with a colleague to share what you learned during the webinar. Explaining to somebody else what you have just learned is a fantastic way to really get it integrated within what you're doing and to be able to carry it forward and put this information into action. You could select one of the actions to increase social connectedness and identify a concrete task you can do for it. So thinking of that slide that I have the summary of the 5 different things, the 5 different actions you can take as a substance misuse prevention professionals, look at one of those and identify what's something specifically that you can do to take action on it. Another action, a possible next step, I should say, is identify one strategy you want to increase your own personal connectedness and put it on your calendar. So if it's that you want to reach out to a specific family member or a friend, and you want to do that perhaps every other week, go ahead and put a recurring appointment or a reminder for every couple of weeks to be able to make sure that you check in with them. I know there's several different friends that I have that we will meet like every other month. These are people who live across the nation, and we can't get together in person. But each time we meet, we set an appointment for the next time that we're going to talk. Even if we need to reschedule it, that's fine. But we have it on there so we remember to connect. And that works really well for me in terms of making sure I'm connecting. And another idea of a possible step is to write a list of 3 potential partners in your area who might be working on social connectedness issues and schedule a time to meet with each of them. So, are there other people within your community working on this? So, if it's working with older adults and you want to make sure to connect with them, or if it's people at the school who are working at this, or there, perhaps another community organization working on this issue, schedule a time to meet with them to talk about this and how you might be able to partner and really augment what each other's doing through your collaboration. All right, of these 4 things, I would love to see in the chat if you're committing to doing one of these within the next 24 hours. Will you commit to this? Put in the chat if you'll commit to doing one of these things or something different. I would love to see in the chat every single one of you. There's 231 of you on this webinar right now. Well, that includes those of us on the back end. So 227 of you. um, I want to see what you're planning on doing. What can you do? Which one of these? So specifically say which action are you committing to? I'd love to see. So I'm seeing water cooler, number 3, number 1. Great. Number 1. All right. Love this. So everybody, I want to see 227 of you putting in here what you're going to do. Keep going. And I will put in the chat. I'm wondering if at the end of this, I'll put my email address that if you would like to email me tomorrow at this time or by the end of this week, whenever you will get this done and let me know what action you took, I would love to hear it. So I will go ahead and I don't want to put it in the chat right now because it'll get lost because of the scrolling, but I will add in my email address so you can email me. All right, keep going with this. And I'm going to go ahead and check on the Q&A. Oh, thanks, Connor, for some clarification. So I think the question was coming from a place of understanding others could lead to identified similarities, which could then lead to social connectedness. Absolutely. Absolutely. I can't tell you a specific study on this, but I think you're spot on with this. And trying to think what the U.S. Surgeon General's report, I don't remember a specific mention of empathy, but it's definitely, I mean, when we talk about the quality as being a vital component of social connectedness, that interactions and those positive interactions, the positive qualities of that requires empathy in my mind. So I think you're spot on with that. And Michelle says, what about self-compassion? Absolutely. Yeah, when we're thinking about those different actions that we can take for our own connectedness, if we don't have that self-compassion, it's going to be hard for us to reach out to others to create those connections. All right, I see a few folks have raised your hands. In this setting, we aren't able to unmute to talk, but if you could go ahead and put in the Q&A any questions you might have, that would be great. And that Rebecca did put in the chat my email address, so feel free to, and I would love to hear from you of what action you have taken. So if you'd like to pull that and send me an email tomorrow or the next couple of days, that would be great. All right. So with that, I want to make sure that you know about some upcoming events that we have for some more training that you can access. Oh, there's my commitment slide. I wanted to leave that other one up so you had those to refer to. All right, some upcoming events. I want to hope that you all will be joining us for on August 7th. If you work with a higher ed community at all, I highly recommend you join us for Preventing Substance Misuse on College Campuses. We have some great folks who are going to be talking with us about that. August 29th from 12:30 to 3:30, we have effective group facilitation skills. That is getting near full. So if you are interested in participating in that, be sure to sign up soon. If you work in an area of substance misuse prevention where you need to report via the CSAP 6 strategies. Highly recommend that you participate in this webinar. We're going to be talking about effective and ineffective strategies for each of those CSAP categories. So it's going to be a fantastic webinar on September 5th on that. Then we have looking at environmental strategies, large-scale impact through environmental substance misuse prevention strategies. That's a 3-hour training on September 12th. And then on September 19th, we have preparing for the ICNRC prevention certification exam. If you are planning on taking the CPS ICNRC prevention exam, highly recommend you join us. That's going to be Nicole Augustine's going to give us some tips and tricks for studying for the exam and taking the exam. All right, if you haven't yet, I highly encourage you to follow and like us on LinkedIn and Facebook if you are a social media user. This is how we get information out to you every day, every work day. We post on there, and these are resources that we hear about or other sources of information that we think would be helpful for you as a substance misuse prevention professional. And as Rebecca said at the beginning, we do have an evaluation form we'd love for you to fill out so that we know what worked well for you, what didn't within this webinar. And please know, I read every comment that comes through, so it's not going into a black hole. And just a reminder that the PowerPoint slides and the U.S. Surgeon General's report are accessible via our product page. So if you haven't already downloaded those, you're welcome to go there and click on the brown boxes on the right-hand side to access those. So with that, Rebecca, any last thoughts that you wanted to share before we log off?
No, I think we're doing well, and we've covered everything that we needed to remind folks of.
Okay, great. And I see one question of when will the webinar for studying for the exam be? That's on September 19th. So just saw that question in there. All right. Well, thank you, everyone. And a huge thank you to Rebecca for all the work she does in putting get these webinars together. She does all the front end work, which is a lot of work, as well as during the time and then after. So huge thank you to you, Rebecca. And I hope everyone has a fantastic rest of your day and that you create many more social connections for yourself and the folks you work with. Take care, everyone. Bye-bye.